So hi everyone, thank you for coming today. We are delighted to have Sue MacLeman here with us, who is the Director of MTPConnect. So I will just be sharing my screen, and Sue has kindly prepared a presentation for us. Okay, so let me first introduce Sue. She has more than 30 years of experience as a pharmaceutical, biotechnology and medical technology executive with senior roles in corporate, medical, commercial and business development. Sue has served as CEO and board member of several ASX and NASDAQ listed companies in the sector. She is currently the chair of MTPConnect, which stands for Medical Technology and Pharmaceuticals Industry Innovation Growth Centre. She's the chair of Anatara Life Sciences, the chair of Tali Digital, non-executive director of Pala Pharma, non-executive director of Aventis Medical, and non-executive director of Vesky. So Sue is also appointed to a number of academic and government advisory committees, including PM Digital Expert Advisory, CSIRO Health and Biosecurity, Genomics Health Futures Expert Advisory Committee, and DMTC Medical Countermeasures. She's also the chair of ATSE Academy Health Technology Forum and ATSE Policy Committee. Her broad commercial experience is underpinned by graduate qualifications in pharmacy and postgraduate qualifications in corporate governance, commercial law, business administration, and marketing. So thank you for joining us today, Sue, and we're so delighted to have you here.
Well, thank you so much for the opportunity to be here. I very much appreciate it. And if you would like to go maybe one more slide, that's great. So Australia is at an important time of growth and change, with innovation across all sectors at the forefront. The current acknowledgement and support of the importance of innovation, combined with the development and highly positive uptake of new technologies, means that we are entering an encouraging perfect storm, allowing us to make an incredible difference, and no more so than the students of ANU. The rapid pace of innovation is outstanding and exciting, faster than ever before, and with this comes immense opportunities, but also some challenges. Modern medical and pharmaceutical technology is allowing us to manage chronic diseases and live longer than ever before, but that comes at a considerable cost to the public health system. Advances in science and technology are enabling personalisation of healthcare solutions, producing targeted treatments and technologies for patients. Patients are becoming more empowered, being at the centre of care, with the ability to access and track their health status via personal health records and wearable devices. There will be a significant shift in how we exchange and process the massive amounts of data generated daily, with standardised data sharing and improved efficiencies for R&D and patient care. We also, as we know, face enormous global biosecurity challenges. And today I'm really going to concentrate on the story of how the industry, along with government and researchers, responded to a very specific need here in Australia as a result of the COVID-19 pandemic. Go to the next slide, please. So I just thought I would introduce the Industry Growth Centre just in case you're not familiar with this initiative. So this initiative, which was led by the federal government, commenced back in 2015, and it was part of the federal government's Department of Industry, Science and Energy and Resources Growth Centre initiative. So they wanted independent, not-for-profit, industry-led organisations that were distinct from government, but funded by the federal government, to actually work with the entire ecosystem to accelerate and boost growth of high growth areas. MTPConnect, which is the organisation that I was the initial CEO of, and now I'm proudly the chair, is one of those 6 growth centres. And there are growth centres in the area of advanced manufacturing, AMGC, with METS Ignited around mining, AusCyber around cybersecurity, NERA around energy, and FIEL around food and agribusiness. We have the next slide, please. So a little bit about MTPConnect. So we were actually formed back in 2015 as part of that Growth Centre initiative I talked about. And we are distinct from government, and we're championing a sector-led approach to accelerate and boost the growth of the medtech, biotech, digital and pharmaceutical ecosystem here in Australia. And we have 4 main objectives: to improve collaboration and commercialisation across the sector, improve management and workforce skills, to improve access to global markets, chains and international markets, and optimising the policy and regulatory environments. We exist to advise and advocate, to promote that greater collaboration, alignment and engagement, and to drive innovation, productivity and competition. Next slide, thanks. One of the things that I mentioned, that MTPConnect is neither a government nor an industry organisation. And as such, we take on a role as trusted independent advisors, and we complement the work that all of the sectors do in the area. So the first one that's quite important is independent voice. So we work with sector participants across the entire value chain to identify policy and regulatory barriers and to provide independent advice and recommendations to government. We also fund a number of initiatives, and we're deploying close to $160 million of government funding, both through the Department of Industry, but also the Department of Health through the MRFF, to actually support research, translation and commercialisation in the sector. And largely we have a team all around Australia. Our head office is in Melbourne, but we actually have hubs in virtually every state, and we deliver education events and support programs. We deliver a number of national and international connections, and we're often involved in international trade missions and work very closely with the other departments, but also Austrade and DFAT. If we could go to the next slide, thanks. Just to set the scene a little bit, I thought it made sense to just touch a little bit on megatrends in health. And these are important because whenever we're thinking about new innovation solutions, you really need to think, well, where are we going? What are the big issues that we face now and into the future? And changing consumer demands and rapid technological advances mean that our sector is particularly dynamic, where the only thing that's constant is change. Developments such as genomics, gene editing, big data and analytics are accelerating the rise of precision medicine and digital health solutions. The ability to develop products and services tailored to individual groups of consumers with seamless digital connectivity and integration is becoming increasingly feasible and holds great promise for enabling better health outcomes for consumers. Consumers are also increasingly aware of the key issues affecting their overall health and well-being and are looking to take more responsibility for maintaining and improving their health. So we're in the middle of a digital evolution. Standardisation of data sharing is accelerating development of new technologies and treatments, and we've seen that with COVID-19 and the nudge to things like telehealth. Cybersecurity, however, is also a growing challenge, and that demands increasing attention. I mentioned that consumers are becoming much more central to their own healthcare, and they want the tools and the integration of technologies to enable them to be involved. We also have new innovations that help us better manage chronic disease so that we live longer than ever before. Mental health conditions such as depression and anxiety are becoming increasingly prevalent, and these are challenging times in terms of finding effective models to cope with those longer lifespans. We also have a goal for healthier ageing, new approaches to maintaining good health for as long as possible and increasing the healthy lifespan. Closely related to the issue with chronic burden and consumer control megatrends, this presents opportunities for new products and services that target healthy living and disease prevention, not just treatment. Precision healthcare, I mentioned this before, the rise of targeted pharmaceuticals, biologics and personalised medical devices, real-time measurement and assessment of individual health will create demand for products and service providers that can offer integrated precision solutions. I won't go into too much detail about value-based healthcare and integrated care models, except to say that they are changing and we're seeing a pivot from volume to value. And of course, right now, we're very aware of the challenges of global biosecurity and our role in the region and our responsibilities for some of those developing markets. If we could have the next slide, thanks. I thought to set the scene and to explain why some of the things we dealt with during COVID-19 were quite challenging, I thought it was useful to be aware of who was responsible for what when it comes to healthcare in Australia. So the Commonwealth Government provides funding to the states and the territories. Obviously they run Medicare and they run the Pharmaceutical Benefits Scheme, which gives us access to subsidised prescriptions. They also do broad health promotion initiatives, look after WorkSafe and veterans. States and territories actually deliver the health services, including our public acute hospitals and our psychiatric hospitals. Legislation and regulation for private hospitals, nursing homes and health professionals, and management of other allied community care and home care, including mental health programs. Local governments very involved with immunisation, environmental and hygiene regulation. And of course, we've got the private sector, private hospitals, general practitioners, dentists, pharmacists, and other allied health professionals. If we could go to the next slide. So when you actually look at the health procurement process, states versus the feds, one of the big challenges that we dealt with COVID-19, of course, is that the states purchase most of the medical equipment, not the federal government. And so there is this disconnect between what the states were ordering and what necessarily we needed at a national level. And I'll talk more about that. But an effective public procurement environment is essential for all stakeholders in the healthcare sector, and better public procurement can help to reduce the pressure on health budgets, deliver better value, and foster the development of better quality products and innovation. If we could go to the next slide, please. So back on the 26th of February, and I remember even before then getting involved in some of this, Australia released its health sector emergency response plan to COVID. And this was really identifying a whole of government and ecosystem response. And I would encourage you to have a look at this plan as well as other resources that are on our website that might actually help as you're thinking about solutions, innovation solutions in this space. So the idea was to monitor and investigate the outbreaks as they occur, to identify and characterise the virus and how bad it was, to really research management strategies, to respond promptly and effectively, to undertake strategies to minimise the risk of further disease and contribute to the rapid and confident recovery of obviously our individuals, our communities and services. And we're right in the middle of that right now. Obviously we've had our initial response and we are still facing big challenges, particularly in Victoria, and I'll get into that in a little more detail. But overall, Australia's actually done incredibly well. We were fortunate that there was good alignment between the politicians at both state and federal level. They listened to the medical experts and they took their advice. And as a result, Australia has been in a much better place than a number of other countries around the world. But let's talk a little bit about that. So next slide, please. So this is a snapshot from the 3rd of August, but you know, as you know, we had our first case back in January. We now are sitting with 20,698 confirmed cases as of today. 11,555 of those have recovered, and very, very sadly, we've had 278 deaths. When you consider it worldwide, though, you know, 19.5 million confirmed cases, 11.8 million recovered, and almost and 724,000 deaths. Here in Australia, our hospitalisations have been going up, particularly in light of the outbreaks in Victoria. We now have 659 patients in hospital, and 53 of those are in ICU. And of course, most of those are actually in Victoria. If we go to the next slide, please. So how did we respond? It became clear in late January that Australia would need to have industry at the table as part of the emergency response to the pandemic. The Medical Technology Association of Australia, along with industry and government, state and federal, and researchers came together along with other industry organisations and of course MTPConnect as well, to set up 4 main task forces to deal with personal protection equipment, PPE, testing and test kits, ICU equipment, and both ventilator supply and local ventilator production. This quick action and structure, now globally discussed as the Australian model, allowed the government to quickly assess what supplies we had on shore and in the system, model what would be needed, and put in place plans to ensure we secured adequate supply. We also worked through some challenges with state permitting around critical personnel movements and freight and logistics, given that a lot of the freight had to be air freight, and that there were a lot of permitting and a lot of competition globally for that freight. We also needed to go to the ACCC because most of these companies are competitors. They would never be in the same room, nor are they allowed to sit down in the same room and talk about pricing and supply and where all of the location of all of their equipment. But the ACCC provided an exemption, and that was coordinated by the Medical Technology Association of Australia. And that allowed the industry, who would usually be competitors, to come together to share information and negotiate challenges on a daily basis. The task forces, particularly the more urgent ones like ventilators and testing, were meeting on a daily basis, as were some of the other ones around ICU equipment. Much of the work was in addition to their normal roles and required a huge effort. And it was impressive to see the Department of Health, the Therapeutics Goods Administration, the regulator, the Department of Industry, Science, Energy and Resources, DISA, and the industry and other experts turn up every day, day in, day out, to solve challenges and make sure we could look after Australian lives. It was a privilege for me to be part of it and something I will always remember. If we could go to the next slide. So Australia's medical technology, pharmaceutical and biotechnology sector has an enviable track record in delivering life-saving new devices and therapeutics. We've done it in the past with innovations like the pacemaker, the bionic ear, and the cancer vaccines, and we're poised to do it again with new COVID-19 vaccines, diagnostics and devices. To better understand the burden of the COVID-19 lockdown on the medical technology, biotechnology and pharmaceutical sector in Australia, we were asked to undertake some research in partnership with LEK Consulting to explore the impact of the pandemic lockdown on organisations across different parts of the value chain and how companies had responded to the crisis. These findings are now published in 2 reports that are available on our website. You're free to download if you're interested. And additionally, a new supplementary report in collaboration with the Medical Technology Association of Australia about the story of how we all came together and made this happen is there. It was originally written as a ministerial brief for Minister Andrews and Minister Hunt, but it might be interesting reading if you want to see how the industry and government collaborated and came together to make sure that we were able to save Australian lives. And obviously to support the national interest and to think about the planning and the lessons learned for future pandemic planning. We didn't get everything right, and you have to take the time to learn those lessons. So if we go to the next slide. So one of the things that was identified very early is that the federal government's Australian Health Sector Emergency Response Plan for COVID-19, the one I mentioned before that was published in February 2020, did not include a specific role for the sector, for the industry, either in its consultation framework or its response planning. And so it's become very clear that without industry at the table, we would not have been able to do what we did. And so the learning for us has been the management of any outbreak will require government, health sector, industry, and the community to work together. Perhaps we go to the last slide, and I can talk a little bit about some of the other learnings. So a couple of things that came out that were vitally important. Collaboration with industry was essential. Being able to get real-time data about where all of that equipment was around Australia, what was on order, what was on allocation, what was being produced locally, what was being made overseas, and how that was being tracked through the system for logistics was vitally important to know that we would actually have enough, for example, ventilators, if in fact the modelling came to fruition and we had to obviously treat all of those patients. We identified data gaps, and clearly tracking infrastructure was not what it should be, and there are some learnings there on how we can do that better. The role of the regulator was critical, and they were incredible to work with. The TGA every day would turn up at the meetings, and they were helping companies navigate regulations so that they could get their new test kits onto the market or their PPE through the system, get it properly tested for safety and efficacy, and make sure that we could actually properly respond. The state and territory response was interesting too. We had state and government involved in some of these task forces, but it also identified a key issue. The states were the procurers. They were the ones that already had the tenders in place with the multinational companies to secure some of these products. And of course, it was a federal response or a national response that was trying to navigate this. And so there were some lessons there about different states doing different things and having different information systems and different ways of interacting and different permitting systems. And of course, the industry was having to navigate all of that as it had to move, for example, expert engineers around to make sure that that infrastructure, those ventilators were working well and would be able to look after patients. Communications matter, and we did lots of communications, and it was very proactive and very open, and that really helped us navigate those challenges. There were border issues, there were biosecurity issues. Obviously, we had to pull forward a whole lot of manufacturing supply, and that has a long-term impact on market demand and the market side of it. Industry involvement was critical. And clearly, you know, one of the other learnings for us is it would have been good to have a national tracking system in place that captured a lot of this data. One of the other things for us is you need a robust and reliable system that can map the needs and supplies of medical equipment as an example here, but many other things as well, like essential medicines and other equipment and medicines. and also skilled staff, and uniform tracking and monitoring across the states and territories, and enhancing that transparency with required data and input from industry, as well as cross-jurisdictional cooperation is super important. So I might just stop there. I'll get you to go to the next slide, because it does have some of our contact details on it, and all of these reports and many others on the sector are actually available for free download from the MTPConnect site. We also have a podcast, which I'd encourage you, if you're interested in podcasts in the medtech, pharma and biotech sector. We have some interesting interviews there, including some around our COVID-19 response. But I might hand back to you and see if there's any questions from anyone.
Thank you, Sue. That was really informative. If anyone has any questions, feel free to unmute yourself and ask Sue. So does the audience have any questions now?
Hi, can I ask a question?
Oh yes, please go ahead.
Yeah. So like how this equipment like PPE delivered to like every Australian family, like.
So if I understand the question, it's how do we get PPE out to Australian families? Is that right?
Yeah.
So clearly early on, there were some challenges with the supplies. So we had just come out of bushfire season, and a lot of the N95 and P2 masks that were used were also similar to the masks being used to reduce particulate matter in the bushfires. And so we started off with a lower stockpile than we normally would have. You probably know that we do keep a national stockpile of essential medicines, but also essential equipment. And that was there to be released as needed. But we knew that we didn't have enough. And so not only did we have to ramp up our supplies from overseas, but we also needed to pivot a number of Australian companies so that they were able to make PPE for Australia. And we did that very successfully. And so a number of clothing companies and a number of other medical device companies then got involved and were actually able to make PPE. We still have some challenges with PPE. I mean, we do have very good supplies, but we are asking everyone to wear appropriate PPE. And I'm originally from Victoria. I'm currently sitting in New South Wales, but I intend wherever I go around Australia, if I'm in a public place or if I'm on public transport or it's not possible for me to do social distancing, I certainly will be wearing a mask. And it does decrease transmission. And so I think it's really important that we take and listen to those healthcare messages because I think that wearing PPE is going to be important for our families, as are all of the other things we're doing: social distancing, washing our hands, not touching our face, all of those things that we're encouraged to do by the Departments of Health.
Okay, thank you.
Do we have any other questions? I sort of have a question for you, Sue. You did touch on it briefly, but I was wondering, why do you think Australia has had such an effective response to COVID-19 compared to what's happened in the States and the UK and other countries?
Yeah, I think a couple of things. One, we're an island, and so I think when we close our borders, we have the opportunity of minimising the disease. And I think, you know, Europe really suffered by people who were travelling quite extensively. And obviously, you know, we closed our borders quite early. And so, you know, even though we had cases coming in from the US and other places around the world, I think we by closing those borders, and, you know, that was a tough decision. I know Brendan Murphy, who was the Chief Medical Officer at the time, you know, had been watching the data and getting his expert advice. And, you know, he ultimately then made the phone call to Minister Hunt, and Minister Hunt then spoke to the Prime Minister about the fact that it was time to close the borders to minimise the spread. And so they did that pretty proactively. And to the credit to the government, they actually listened to that expert advice and they took initial actions, which I think was very good. The other thing, of course, is that we very quickly started testing. putting in place the plan, the emergency response plan that I mentioned, to ensure that everyone was mobilised, and that even though we all scrambled and we didn't do it perfectly, I think actually overall the response was as good as it could have been, with other learnings that we will take forward. So I think it was partly that. I think all along the way, the government has listened to the medical experts, and we're very fortunate in Australia that we have some very experienced and talented individuals who are skilled with working with pandemics and global health issues. And I think that their advice was being taken, and I think that that's meant that Australia has been extremely fortunate. Now, clearly we have outbreaks, and that will continue unless we can get those global health initiatives in place, and hopefully eventually get a vaccine for the populace. But right now, it's a pretty good response. We're seeing the numbers come down in Victoria, but people have to be vigilant. And I know it's tough and people hate being in lockdown, but we have to get through this. And the only way we're going to get through this is together, and by taking that expert advice from our health departments.
Thank you. Does anyone else have questions? Oh, I have another question. You had mentioned that we had a low supply of N95 masks due to the bushfires, and we had to quickly ramp up or obtain supplies from overseas. But I imagine at the same time, all the other countries are scrambling to get the same supply. So how do nations negotiate with each other about who gets those supplies?
Yeah, so I think, we already had supplies in the system and tenders in the system and companies that were already providing and had orders in place. So there's the first response in that we were quick to make sure that we had orders in the system from not only the suppliers we usually use, but also managed to make sure that we looked at other suppliers and made sure that they got through the regulation to ensure that we had a number of different suppliers that we could go out to. I think there was a number of instances where we couldn't get supply, and part of that was because some of it was on allocation, and some of that allocation was actually being allocated to countries that had a far worse situation than ours, for example, in Italy or the UK and Spain. And when you think about it as a global citizen, you actually want a lot of that technology to go where it's most needed. I mean, that's the part of being a good corporate citizen. And so perfectly understand that some of that allocation went elsewhere when it was needed. But I think that we mobilised quickly, we got good supplies, we continue to get good supplies, and we have also worked with the local industry to make sure that we've built a sovereign capability and a supply chain resilience here in Australia to also support the production of that PPE here in Australia for Australians.
Thank you.
Hello, can you hear me? Hello?
Oh, yeah, we can hear you.
I just wanted to ask a question on top of what Sai asked. So what about hospital beds? Were there any mechanism or system in place that you can tell people like this hospital is full, please go to this hospital and search? Because I understand that in my country we did not have that system. So whenever we want to go for a medical checkup, we always go for the same one, and we always had to wait for a very long hour and maybe very crowded as well.
Yes, so certainly there were crowds in a lot of our hospitals as people wanted to get tested or were unwell. I think we have quite a good system here in Australia to work out where we have beds available, and that's been established for some time, and it's used, of course, when ambulances are wanting to go to a particular hospital. If there is a major event, there are communications that are used to say which hospital they should go to, which ones have capacity, which ones are full. I think we could still do it better. I think there's still an opportunity to do that better, right across, not just for hospital beds, but across the whole medical stockpiles and coordination efforts. One of the things that we did identify very early on is that we needed more ICU beds and we needed more ventilators. And one of the things that we did was we were looking around as to whether or not we could repurpose, for example, beds that were in private hospitals. We were seeing if we could repurpose beds that were used in recovery post-surgery, whether or not we could turn those into ICU beds. we were thinking about the sort to make sure that they were fully functional. We were making sure that we had enough ventilators for patients, but all of the other equipment that's needed as well, the breathing circuits, the oximeters. And we're also thinking about, you know, where we were going to need that, where the push was coming from. And you would have seen that in Victoria, when the numbers started to climb, you know, we were having to call upon our colleagues in New South Wales, particularly, to help us with some of the testing, for example, that was going through the pathology labs. But that's an appropriate response. You want everyone to be mobilised and to be helping where they can. And I think we did it relatively well. There are always things that we could improve, though.
Thank you, Sue.
Do we have any other questions from the audience?
Sorry, I just wanted to clarify, Sue, was that system just for the ambulance and the hospital, or was it open to public, like any civilian can also go into the system and find out like which hospital has the most bed currently?
No, that's right. It was restricted to those in the healthcare setting and as part of the emergency response. And so that would be coordinated through the various emergency response teams and infrastructure that was in place. So no, a person couldn't do that. Having said that, we set up hotlines, or we didn't, I wasn't involved, but some very talented people in the health department set up information and hotlines and made sure that we have things in lots of different languages, that we put a lot of information out through social and other media sources so that people could actually look things up online and know where the pressure points were and how to get the best care. In some instances, they set up drive-through clinics in car parks, or they set up separate entrances to hospital for patients who thought that they might have been exposed to COVID-19. And that allowed them to manage some of that workflow a little bit more effectively. There was also some planning to think about, you know, did we need to set up infrastructure like Nightingale hospitals, like the UK did, where they actually built specific infrastructure relatively quickly in order to deal with those COVID-19 patients. And so I think there's been a lot of thought and planning that goes into that. And Australia has pandemic planning all of the time, or emergency response planning all of the time. And I guess that all got mobilised fairly quickly, and we got to test it a little bit. And some of it went very well. Some of it, we took some key learnings away from that, and we'll do better next time.
Thank you again.
Okay, did we have any final questions for Sue?
Hi, Sue, can I ask another question?
Yes, go ahead.
Yeah, thank you. So, like for like during this pandemic in Australia, like how how do we arrange the some PPEs between like different states and different hospitals, and like how do we usually get like deliver these PPEs to some people, say, who live very far away from a big city? Thank you.
Yeah, so we have national stockpiles of PPE, but we also had most of the healthcare sector had access to PPE. They also mobilised to move some of that PPE. So, for example, in some of our more remote and regional communities, we actually needed to make sure that either through defence or other mechanisms that we moved PPE into those locations and made sure that they had the equipment that they needed. We also had a lot of some additional staff that needed to be trained, and so there was a concerted effort to make sure that we had experts in the field that could actually help in some of those regions and to make sure that they had the equipment that they needed. There's also, if you look at WHO website around COVID-19, you'll also find some checklists of what you need in a pandemic like COVID-19, and so you almost have a checklist of equipment that you're going to need and a checklist of the sorts of consumables you're going to need. And so I think a lot of public health experts, you know, were involved in thinking about where all of those supplies were, where was the need, and making sure that they got it to where it was needed as soon as possible. But look, we can always do better. I mean, I think there's opportunities for national tracking system of equipment and some of these disposables. I think there's opportunities for better liaison platforms between industry, academia and research and government to make sure that we understand what's in the system, what's on allocation, when it's going to likely arrive. There's a whole lot of modelling, of course, that's being done by the experts about where we think that's going to be needed, so that when it does come, that we're ready. In the early stages, we were trying to buy ourselves time, if you like, while we managed to ramp up production of all of the things that we knew we needed and to make sure that we had those supplies. In Australia, we were very fortunate in that happened, and we're very well prepared. And I guess we did learn some lessons from some other countries that really struggled early on to protect their populations and to have all of those medicines and medical equipment that they needed in the right place at the right time. But, you know, I still think there are opportunities, and you're going into a hackathon to think a little bit about this, you know, national coordination and tracking systems, even regional tracking systems of orders. You know, there are all sorts of opportunities, I think. There's a whole lot around personnel. I mean, I'll tell you a story very quickly where we were having to get engineers across state borders in order to service, for example, ventilators in tertiary hospitals. And because of the permitting system, you know, we were slowed down by that, or those people, when they got into that state, were obviously put into quarantine, even though that they had all the permits in place, and we needed to make sure that we could get them out of quarantine, get them to the hospitals so that they could actually service that critical equipment. And all of that took a lot of coordination that was very time intensive and resource intensive. And I'm sure there are better ways we could have done that, by thinking about preventive maintenance, by thinking about a proper permitting system that was up and running and was consistent across all of the states and the federal government. I think, you know, making sure we knew what was in the system, where it was, when it was likely to arrive. I think there are a lot of tracking opportunities here, and I think there is an opportunity to kind of do that better next time.
Okay, thank you.
Okay, we might end this workshop now, unless anyone has any final questions for Sue. Thank you so much, Sue, for joining us today. We are very lucky to have to hear from your expertise, and the work you do really is incredible. So thank you so much for joining us today in our workshop, and I'm sure everyone's grateful to be able to hear from your experience in the field. So thank you, Sue.
Thank you, Sai. And good luck to everyone. I hope you come up with some terrific ideas and terrific new innovations so that we can do this better next time.
Okay. Thank you, everyone, and good luck with your hacking. Okay.
Thank you. Bye.
Thank you.